Let's begin with the first section of our lecture, neoplasm of nasal cavity, and in this we will focus on the benign neoplasm of the nasal cavity. Some common benign neoplasm which we will discuss in this section will be squamous and inverted papilloma, pleomorphic adenoma and Schwannoma, meningioma, haemangioma, and angiofibroma. So if you see all these benign neoplasms, they end with the word oma, which is the tumor growth or tumor, and usually it's named after the site of origin of the tumor or neoplasm, like Schwannoma, developed from the Schwann cells of the nerves, and meningiomas develop from the meninges. So it's usually it gives a little self-explanation of the origin of the site of the tumor, depending on what side it is. So let's begin first with the neoplasm of the nasal cavity, and in this section we are talking about benign neoplasm. So neoplasm can be benign, and there are some differentiating features between the benign neoplasm and malignant neoplasm. So benign are more localized in origin. They are not metastasized to distant site as compared to the malignant neoplasm. So benign are smooth and localized, covered with mucous membrane. They are covered with mucous membrane, and they are smooth and localized. As compared to benign neoplasm, the malignant neoplasm, they are friable, have a granular surface. So they are not smooth like the benign neoplasm. They have granular surface and they are very friable. Also, because they are friable, vascular, they tend to bleed very easily if they are touched. So one is smooth, localized, one is granular, friable, and they bleed very easily. These are some pictures showing the neoplasm. This is the swelling of the external surface of the nose with the neoplasm, and this is the neoplasm in the nostril. So this is the diagrammatic appearance of the neoplasm. Next, the benign neoplasm. Benign neoplasm, different types of the benign neoplasm are the squamous and inverted papilloma. Then we have pleomorphic adenoma, Schwannoma, meningioma, haemangioma, angiofibroma, chondroma, intranasal meningoencephalocele, and gliomas. So all these are the different benign tumors of the nasal cavity and gives us the idea of the site of origin of these benign tumors also. And if you say they are more localized, limited to one area, and they are smooth in appearance also. And the dermoid cysts. Dermoid cysts are also benign neoplasm. So all these are the examples or the different types of benign neoplasm of the nasal cavity. Squamous papillomas. First, squamous papilloma. These are the pictures of the squamous type papilloma. Similar to skin warts. Viral warts, they have similar appearance as the squamous papilloma. Arise from nasal vestibule, from the vestibule of the nasal cavity, or from the lower part of the septum. So this is the site of the origin of squamous papilloma. Single or multiple, it can be just one or there are multiple squamous papilloma. pedunculated or sessile. As we talked about the polyps, we know the sessile polyps are the polyps which are attached to the skin. They don't have any stalk attached to it. And the pedunculated are the one that hang with the stalk. So same with the squamous papilloma, like the polyp, it might be sessile or pedunculated. Treatment is local excision with cauterization of by laser cryosurgery or by base cryosurgery or by the laser. So it's excised by the cryosurgery, which is the cold therapy, and by the laser. So it's excision, local excision with cauterization, which can be by laser or by cryosurgery. So this is the squamous papilloma. Then inverted papilloma. Inverted papilloma, it is a tumor of the non-olfactory mucosa of the nose, which is known as cnidarian membrane and paranasal sinuses. So it is the tumor of the non-olfactory mucosa. Olfaction is the sense of smell. So the non-olfactory mucosa of the nasal cavity is involved in the inverted papilloma, and also mucosa of the paranasal sinuses. Common site is lateral wall in the middle meatus. Squamous papilloma, we saw it from the lower part of the septum or from the vestibule. But inverted papilloma, it is from the lateral wall in middle meatus. Grows into stroma hyperplastic. So it becomes hyperplastic and grows into stroma. Always unilateral as compared to squamous papilloma, which can be multiple, single, unilateral, bilateral. This is always unilateral on one side. Presents with some features of inverted papilloma is nasal obstruction, nasal discharge, and epistaxis, bleeding from the nose. Here you can see there is some bleeding from the nose also. And the site of origin as compared to squamous papilloma, which was located little lower, close to the vestibule and the septum. This is from the middle meatus, lateral wall of the middle meatus. Diagnosis and treatment of these papillomas. Diagnosis is endoscopy is performed. On endoscopy, there is pale polypoid mass. You can see the polypoid mass. CT scan and MRI show location and extent of the lesion, how far, how deep it is. Biopsy is usually performed, always should be performed, to find out whether it's benign neoplasm, it's malignant neoplasm, what type of cellular changes, what type of morphology is present. So biopsy. Treatment is medial maxillectomy. Ectomy is removal, medial maxillectomy. Lateral rhinotomy, opening of the nasal cavity laterally. Sublabial degloving approach, and wider external surgical approaches. So all these are different treatment options. Mainly is the surgical treatment. We can do it by medial maxillectomy, lateral rhinotomy. Otomy is the opening. Ectomy is the removal. So, and then the approach is usually sublabial degloving approach and wider external surgical approaches. So it's both approaches can be used. Pleomorphic adenoma and schwannoma. The other type of benign neoplasm now we will talk about is pleomorphic adenoma and schwannoma. Adenoma is rare form of benign tumor of the nasal cavity and develop from the nasal septum. This is the septum which divides the nasal cavity into right and left sides. That septum, it gives origin to the pleomorphic adenoma. Treatment is wide surgical excision, opening and removal of the tumor is the treatment. Now schwannoma, uncommon from nose or paranasal sinuses, as also not very common benign tumor, schwannoma like adenoma. It develops from the Schwann cells of the nerves. The nerves are covered by the Schwann cells, and this tumor develops from the Schwann cells of the nerves. Rounded yellowish mass which is firm is present. Diagnosis is by CT, MRI and by biopsy. Treatment again endoscopic surgery or by external approaches. So tumor can be approached by endoscopy or by opening or by incision on the external surface, and it can be approached and removed. So all these are the treatment options and of adenoma, schwannoma, and how they present. Both are rare, not very common tumors. Next, meningioma and haemangioma. As the name shows, meningiomas develop from the meninges, which are the three coverings, cover the brain and the spinal cord. We have pia mater, arachnoid mater, dura mater. These are the three meninges. Pad, remember pad, pia mater, arachnoid matter, dura matter, going from inside to the out. So these are the three meninges, and the tumor developing from these meninges is known as meningioma. So meningioma, uncommon again, it found it intranasally. Treatment is surgical excision by lateral rhinotomy, is on the lateral side of the nose. A cut is given and the enter to remove the tumor. So it's again not very common and it found intranasally. Then hemangioma is from capillary hemangiomas. We have that develop from the capillaries. Capillary hemangiomas, they are soft, red, pedunculated or sessile, so they may have peduncle or stalk, or they are sessile. Ulcerated and present with epistaxis. Hemangiomas are very common. They present with the epistaxis or bleeding wherever they are formed. So because of involvement of the capillary in capillary hemangioma. From anterior part of nasal septum, so it develops from the front of the nasal septum, anterior part. Treatment is by local excision. Next is cavernous hemangioma. It from the turbinates. Capillary hemangioma was from the septum, but cavernous hemangioma developed from the turbinates. Treatment is surgical excision with cryotherapy. Cryo is cold therapy, and it is surgical excision with cryotherapy. Extensive lesions, we should do radiotherapy for the treatment of extensive lesions of cavernous hemangiomas. So hemangiomas, mainly two types, capillary, cavernous hemangioma. Both are removed by excision. One is from the anterior part of the septum, one is from the turbinates, and then capillary hemangiomas, they bleed very easily, and they have can be sessile or pedunculated. These are the pictures of the hemangiomas and the tumors. Next, angiofibroma and chondroma. Angio is for blood vessels and chondro is the term used for the cartilages. So these are the site of main origin of these tumor. Angiofibroma, origin is posterior part near sphenopalatine foramen. So posterior sphenoid and the sphenopalatine bone or foramen is present posteriorly. So that's the main site of origin of angiofibroma. Chondroma is from ethmoid, nasal cavity or septum. Smooth, firm and lobulated. In this picture you can see smooth, firm and lobulated, mixed type, fibro, osteo, angio type. So all three types can be combined within chondromas. Tendency to malignant transformation. Treatment is with surgical excision. So all these two differences between the different types, angiofibroma, which develop from posterior part of sphenopalatine foramen. Chondroma, they develop from the ethmoid, nasal cavity, septum. They are smooth, firm and lobulated. Sometimes they have mixed type. Different types are involved. Bone, blood vessel, fibrous tissue, so all these combine and they have tendency to become malignant. So this chondroma here we saw, they have a tendency to transfer from benign to malignant neoplasm. Intranasal meningoencephalocele. Meningoencephalocele is herniation of brain tissue and meninges through foramen cecum or cribriform plate. It presents as smooth polyp between septum and middle turbinate. So herniation, when there is protrusion of the brain tissue and meninges. Meningo is for meninges, encephalo is for the brain tissue, cele is for herniation. So it's the herniation of the brain and meninges through the cribriform plate or foramen cecum, and it presents as a smooth polyp between septum and middle turbinate. Increases in size on crying and straining. Whenever there is herniation, when there is increased pressure, there is increase in the size or bulging out of that hernia. So in this case also, when there is crying or straining, there is increase in size of the meningocele or herniation. Misdiagnosed as simple polyp. Sometimes people think or the physician think it's a simple polyp. Causes CSF rhinorrhea or meningitis. CSF rhinorrhea is when cerebrospinal fluid flows through the nose. So when there is hernia of the brain and meninges, the cerebrospinal fluid that flows in the between the meninges, different areas. So that space, that fluid leaks through the nasal cavity, through the hernia and cause CSF rhinorrhea. And also it can cause inflammation of the meninges. Diagnosis is by CT scan and treatment is frontal craniotomy, repairing bone defect, mass removal. So opening of the cranium, skull and removal of the or repair of the defect is the treatment. Gliomas. Gliomas are common in infants and children. You can see big tumor here, big growth, gliomas. Present as form polyp, protrude at anterior nares. Extranasal is 60%, intranasal is 30%, and both intra and extra is 10%. So extranasal gliomas are more common here. You can see it's a big glioma which is present extranasally on the outside. This is the intranasal inside the nasal cavity, and we have both intra and extra in about 10% of the cases, and they are common in the children. Nasal dermoid, these are the dermoid cysts, and usually they have small pit or opening also. Present as widening of upper part of nasal septum. The upper part of nasal septum becomes wider. There is hypertelorism. Because of the widening of the upper part, the two eyes, the distance between them it is increased, known as hypertelorism. Pit or sinus in midline of nasal dorsum. Usually the dermoid are associated with pit or sinus here. Hair protruding from opening. So this is the dermoid, nasal dermoid, which present as widening of the nasal septum, upper part of the leading to hypertelorism, increased distance because of the widening of the nasal septum, and there is protrusion of hair from the opening. So this is nasal dermoid. So all these are the benign neoplasm of the nasal cavity. Some of them are not really very common, they are rare. Some are common, they are more localized, smooth in structure, and they are as compared to malignant, which are friable, granular surface, they bleed very easily. So these were all the benign neoplasm of the nasal cavity. So that's all about section 1. Thank you for watching sqadia.com.